of the College of St. Rose, and I'm really thrilled to welcome you this morning to the college as we discuss one of the most relevant topics, the use of data analytics in healthcare. I'm proud that St. Rose is hosting this event as part of our year of launching our new master's degree in business analytics. A recent Computer World survey ranked business analytics number 2 for the most difficult skill for managers to find, with salaries starting at more than $87,000. With those numbers as a starting point, we are very excited about the potential for this new degree at St. Rose and for the interest it is generating from prospective students in the capital region, across the country, and around the world. Developed by our Heather School of Business faculty last year, this new master's degree started enrolling students this past fall and continues to grow in applications and enrollment. I want to thank Interim Dean of the School of Business, Dr. Mike Matthews, who's here today. There he is. And also Assistant Professor of Business Analytics, Dr. Eyyub Kibis. And where is Eyyub? Oh, there you are, of course, on the panel. I'm looking in the audience, and you're right to my left. And Dr. Kibis just joined the college this past fall, and he's already making enhancements to the program based on his expertise. Now, one way that Dr. Kibis is augmenting this program is by partnering with computer science faculty members as they build new graduate programs in computer science and information technology. By cross-pollinating these degrees with core courses in computer science and math, students become highly skilled experts and managers in these fast-growing technical fields. The graduates of these programs will be in demand in any area in which business decisions are made, from education to finance and from government to manufacturing. There is not a leader of a company, organization, or sole proprietorship who is making a decision without data and metrics, and that, of course, includes me as a college president. I'm exceptionally pleased that St. Rose is leading the way in business analytics in the capital region. The focus of this morning's panel is how data analytics are shaping the future of healthcare. And now I have the pleasure of introducing our panel moderator, Mark Egan. Mark serves as Chief Executive Officer of the Capital Region Chamber, which represents 2,600 member organizations that employ more than 150,000 area residents. The Chamber provides leadership and advocacy to advance economic prosperity in Albany, Schenectady, Rensselaer, and Saratoga counties and beyond. Since my first days in Albany, Mark has been a good friend in terms of providing me with advice about the region, and I thank you, Mark, for being so welcoming. And he's always been an advocate for the strong role that higher education, and particularly private colleges, play in our local economy. I can remember many phone calls when I talked to you and found the kind of support that I was looking at St. Rose, and we really appreciate that. Now, of course, the advocacy and the support of the Chamber goes beyond my presidency and Mark's leadership. And really, the Chamber has been supporting the College of St. Rose for more than 2 decades, helping our students to get internships and jobs. And in particular, as he continues those efforts, I want to thank Mark on the behalf of our students and on the behalf of St. Rose, and also for agreeing to come and be with us this morning to lead this panel. So I call you up.
Thank you, Carolyn. Good morning, everybody. It's terrific. As I look in the audience, I see lots of familiar faces from our business community, but it's great to see members of the student body who are up this early who are with us this morning. I think we're going to have some good discussion. I was chatting with the panelists earlier, and here we are in a college, and our younger students that are here, and then some of our students who might be a little older who are in the master's program. I entered college in 1983, and when I think then of the way that you got information, some cases it was, went to my parents' encyclopedias that they had bought about 20 years prior to that. Or if I really wanted the latest information, I could go to the library and look things up on microfiche. And you look at today in the power of data, and how it can help us make informed decisions, how it helps companies, whether it's to grow in new markets, whether it's to make discoveries to improve healthcare, or really, as we know, how we're truly a global world, and it all pulls it together. I want to commend the College of St. Rose because, I think that institutions of higher learning, those that are really on the cutting edge, or those that really, they're looking around the corner. And sometimes they're discovering things before others know that they're there. And I think for them to develop this master's program and what it can do to really help develop stronger careers for the graduates is one thing, but again, what it can do to help our area businesses, and again, to my earlier comments about hopefully, ultimately, really transforming the way that we operate as a global society. So again, kudos to St. Rose. We have 3 panelists this morning, each with different backgrounds. But I think as we have our discussion, you'll see how they're really complementary of each other and probably can provide a unique slice to different areas. And the plan is I'm only going to ask them a couple of questions. And then our hope is that members of the audience, that you'll have a variety of questions that you would like to pose. I thought what we'll do is we'll start off by asking each of the panelists to introduce themselves. So instead of me providing a long formal introduction, they can really talk about their background, and particularly as it relates to our topic this morning. And then after they do that, so again, we're not going to go through it. After like one person does sort of their self-introduction, they're really going to go right into sort of the first question to help frame it. And it's really how do big data and data analytics impact your business, your industry? So with that, why don't we start all the way over and Pat, and then we'll work our way down.
Great. Thank you, Mark. So thank you to the College of St. Rose for having me come speak to you today. It's an honor to be here, and I want to thank everyone for coming. My name is Pat Roohan. I am currently the VP for Data Management and Analytics Solutions at MVP Healthcare. I previously was at the New York State Department of Health as a former deputy commissioner and was in charge of many, many things at the end. We kept adding on. But the core what I was involved in was measuring and monitoring quality, a lot of data, a lot of Medicaid data, some finance, some rate setting. Over time, my group has incorporated responsibility for the all-payer database, Sparks. So major data systems in New York, as well as the electronic medical record world of the shiny HIE world. So I came from that world. The department spent a long, wonderful career in public service, and now I'm at MVP. Lots of data in the state, which we can jump into if you want to, but I'm going to focus my quick talk here on what we're doing at MVP. So as the lead of analytics at MVP, my role is really to get MVP to a different place where we, like many insurance companies, are working, have a lot of data. We've had a lot of data, claims data, and information about enrollees. But the new world is how do we connect other data? How do we connect clinical data? Electronic medical records, which many of you have seen in the doctor's office with a belief system that are all connected. From my old world, we try to do that. We're trying to do that. At MVP, we're trying to do that. We're not there yet. However, this is a frontier that we all are dedicated to, not just at MVP, throughout the state, because this is the future, to be able to get real clinical data, real time, to know someone's hemoglobin A1C, level at Dr. A when at Dr. B 3 hours later is really important. So connecting data together is what we're trying to do at MVP. We're trying to do that better, quicker. We are involved in many projects with different parts of the organization, some new to me, some old. So a lot of the work I do is related to quality of care, working with the medical management team, working on HANYS and QAR, which are the New York State requirements of performance of the plan. We're also working very closely with providers on a term called value-based care. So value-based care, value-based purchasing is the idea that we, MVP, would pass on, at the furthest level, pass on some level of risk to a provider group. So that provider group would get, at the highest level, would get make a number up, 90% of premium, and they would be responsible for virtually everything for that member for MVP Healthcare. This is a mandate from the state, my former colleagues in the Medicaid program, on the Medicaid side, that Medicaid managed care gets to 80% what we call VBP, and the state side value-based purchasing. So health plans like MVP need to provide more information to providers that they haven't done in the past or at the level they haven't done in the past. So, for example, not only MVP is responsible for improving immunizations, so is Dr. Morley in the front row. He was a pediatrician. He's not. Because we're paying him a differential on whether he got kids immunized or not. So that data to get to the next level in healthcare is one we're working on. We're very early in working with data to focus on the consumer and marketing, and more to come on that probably a little bit later. A lot of work we do is related to finance, obviously, as a health plan. The understanding where that premium dollar goes is the precious dollar is a contest every day that we do to try to figure out where we can be more efficient, and that will also work with contracting and how we can improve contracts. So analytics has permeated MVP at every level. A tremendous support. I've been there 9 months. It's been a tremendous opportunity for me, and I look forward to conversation today.
Great. Thanks,
Thanks, Mark.
Megan?
Hi, everyone. My name is Meghan Morrissey, and I am a senior data analyst at HANYS Solutions. HANYS Solutions is the fully owned subsidiary of the Healthcare Association of New York State, HANYS. And at HANYS Solutions, I work with clients, hospitals, hospital systems across New York State, and I really help them analyze the diverse communities they serve and help them understand their competitive market position. And we have a product at HANYS Solutions that our clients license and work with called IBM Market Expert. HANYS Solutions is partnered with IBM Watson Health for this product. So I work with hospital systems across New York State to leverage that tool, to work with the data in the tool and help them extract the information from that system itself. So big data, when we think of it, most people just think of a large amount of information. But for my clients, it's also really important to take into account data quality and the conclusions that you're able to draw from the data. For my clients, they need to make sure that the information that they're using to make their decisions is accurate and it was collected properly, it was processed properly, stored properly, so that when they make decisions based on that, they're making decisions on actionable information. What you're able to do with the data is just as important, if not more important, than volume. So when you're thinking about big data, it's also important to think about, can you access the data in an accessible format? Are you able to properly draw conclusions from that information? Can you use that information to convey thoughts to others through presentations to allow them to draw their own conclusions from that? And then also, is that data actionable? If you have a bunch of information, but you can't extract any information from it to actually make a decision off of it, the data itself is useless. So at HANYS Solutions, we really work a lot on the data quality and the data submission side as well, to make sure that that data that we're actually giving to our clients is complete. It was collected properly, it was managed properly for them to make decisions with it. So Market Expert, it's a planning and marketing tool. Through our partnership with IBM Watson, we have a slew of data sources in that tool. We have Medicaid and Medicare claims data. We have demographic data in there. And then we also have Sparks data, which Pat mentioned. And that's kind of one of the main reasons that our clients seek analytics from HANYS Solutions. So Sparks is an all-payer data reporting system. So anytime anyone's hospitalized or receives services in the emergency room, they have to report that information to the Department of Health, and it gets reported to Sparks, and then we actually get that information. So the reasons our clients use this in the hospital industry is, they obviously have access to their own internal data through their internal records, but they need to know what's going on down the street at a different hospital in their area. From a competitive marketplace position, they need to know, why am I losing some of my business to our competitor down the road? What do they have, and what are they doing that are drawing patients in, and we're losing that business from them? So with Sparks, it's great, it's come a long way, but there are limitations to big data and data collection and data sharing. So Sparks, is unique to New York State. So for a lot of clients that I work with in the hospital industry, especially hospitals that border other states, if they're losing any business to other states, they have no information on that. Some states have an equivalent to Sparks and collect that data. Some states do not have an equivalent. And often states that have an equivalent won't share it with anyone unless you're living in that state. So that's a really big limitation to kind of the strategic planning and marketing division. So the ways to overcome that, we have all of the other data sources to kind of complement one another. And to our clients, enriched data is more important than big data. So taking parts from various data sources and parsing them together, that actually means something, where they can actually take one data element from one data set and supplement it with the other to give them actionable information. Also, one of the things that we do a lot at HANYS is protecting the data. So all of the data that I work with on a daily basis and that I'm giving to my clients are patient-level data. And having people realize that these are not just data points, these are real people. These are people that are coming in for services, they're being taken care of by physicians. Everyone in this room at some point in their life has utilized healthcare services. So it's our job as a data analyst and at HANYS to protect that information and to make sure that all the reports that we're giving out are HIPAA compliant. And it's also a challenge for us to give our clients enough information that they can actually make decisions, but also to protect the identities of the individuals that the data represents. And the demand in recent years has really increased. Here at HANYS Solutions, our client base has really increased from the past 15 years. And a lot of that has to do with policy changes. So our clients need the ability to understand how a policy decision would impact their hospital and their market before that decision is made. And through our IBM Market Expert tool, we give them forecasting estimates, we give them what-if scenarios under different assumptions, so they can actually see in their market, how did healthcare reform impact their market? How would their market change if the ACA were to be repealed? And that's what a lot of our demand has been in the recent years, to understand that. And hospitals are kind of in a unique position. In their industry, they're providing care for individuals, making sure that that care is great with the best patient outcomes. But they also have to make money. They have to keep their doors open to pay their staff. So they have to have information to be competitive, to have the best type of technology, have the best physicians, so they can draw that business in to keep their doors open so they can continue to care for the individuals they're seeing. And that's kind of the reason why our clients need the data. And also with the data in healthcare, it's kind of different than other industries like business or finance or even like social media. All of the data that we collect there's a middleman to it. So we rely on that middleman to collect that information, import it properly, and then we get that data on the output side. So, when you're working in a hospital, there's no machine to scan a person and say, oh, this was your diagnosis, this is your procedure. In a perfect world, that'd be great because we'd know that all of the data was collected properly, same methodology, but in the world we're living in, we don't have that. We have to rely on the submitters. So another service we have at HANYS Solutions around data is working with data submission on the data submission side. So we have people who's been in the industry for 20 plus years working with submission to output so they can really help our clients understand the strengths and limitations of all of the data elements. And just to conclude, I don't think we're where we need to be in terms of an all-inclusive, all-payer data reporting system that collects from every site of service. But we're definitely on the right path. Sparks has come a long way from 1979 when it was created. It was initially created for just collect inpatient discharges. We now collect data from 4 types of care settings. And I think we're at a point in time where we have all of this information, big data as we know it, but we need to start moving towards small data. So taking those big data elements, seeing what's in those data sets, what can be used from those data sets to actually make decisions, and then use that data to actually determine what we need to collect in the future to make better decisions in healthcare.
Terrific. Can I ask you just maybe one quick
Sure.
I don't want to say follow-up question, but I think for folks in the audience, whether they're from industry or from those who are students, undergrad or grad students here, talk about just quickly your background and then how you went for a master's degree and how you even discovered this line of work.
Sure. So I went to get my bachelor's degree at Wagner College initially in microbiology. So I was working in the lab, with bacteria, viruses, all of that. Kind of wanted to be a doctor, but I didn't want to be, in the operating room with blood everywhere. So I was trying to kind of find that niche for myself where I could still help people in healthcare and make people's lives better and easier, but not necessarily, seeing the inside of a body. So I got my bachelor's in microbiology, and then I went on to get my master of public health degree at the University at Albany. And I focused mainly in epidemiology, the study of diseases and population. And I kind of didn't know what epidemiology really was until I went in and actually got my degree and started taking courses. And there were just so many different aspects of that field. And actually, when I started as an intern, I started as an intern at HANYS as part of my degree requirement. And I was like, oh, HANYS, I never heard of them. I don't even know what I'm going to be working on, data reporting, data cleaning. Oh, this kind of sounds cool. And kind of from day one, I was submerged in, writing code to look at data sets, working with data. And I quickly, realized, wow, I didn't even know this was kind of here. So that's kind of how I got involved in it. And a lot of people don't know it's out there. That's why I think it's great that St. Rose is developing this program to say, hey, there's a really increasing demand here for analysts, developers, IT professionals in this field, and it's going to give students the coursework and knowledge that they need to go into the field.
A perfect transition over to our next panelist.
Yes. Good morning. This is Eyyub Kibis, Assistant Professor of Business Analytics at the HANYS School of Business. First of all, I would like to thank the program committee for organizing this event. So, I've been in this area for the last 10 years. How am I in this area? I did my master's degree in finance and econometrics. And after that, I started my PhD degree in industrial engineering. So it is finance, economics, econometrics, and then after that, industrial engineering. I started working on big data when I was in the finance program, and I was working on the reputation of investment banks. Then when I started my PhD program, I realized that, attending conferences, having conversations with professionals, I realized that there is a potential in healthcare area. So why we have a potential in healthcare area? Before going into that one, I would like to start my talk with a quote from a famous statistician, William Edward Deming. So he is a retired professor. He passed away actually 20 years ago. He says, in God we trust, but all others should bring data. So it is how data analysts think about the world. It is with data analytics, with the data that we are handling currently in our hand, we will be dealing actually huge amounts of data. If we specifically talk about the healthcare data, in the future we are expecting yottabytes of data. So if you think in numbers, it is 10 to the power 24. It is a huge data that we are talking about. So what does that data include? Well, it includes physician notes, prescriptions, medical imaging, X-ray images, and even you can talk about Twitter posts, Facebook posts that are related to healthcare. And if you combine all those variety of data, you will have huge amount of data in healthcare area. And we can also talk about the velocity of data. So velocity of data is huge in healthcare. The reason is, and it's going to increase, pretty significantly in the future, but the reason is we are expecting to have variable smart technologies, like smartwatches that can track our health records, blood pressures, or EKG reports. These are the things that can be easily tracked with variable smart technologies. So with the velocity of the data and the volume of the data, and also we can talk about the variety of data, there is huge potential in healthcare area. We had a 1-hour meeting with Chief Information Officer of Albany Medical Center. It's George Hickman, like 1.5 months ago. And at some point we started talking about the impacts of no-show patients on healthcare industry. So no-show patient means it's basically a patient who make an appointment but does not show up in his or her appointment. He said they are losing huge amounts of money because of no-show patients. If you think about that in terms of U.S. economy, it impacts U.S. economy by $150 billion. So we are talking about 150 billion waste in the economy. And if you look at the entire healthcare area, McKinsey & Company estimated that we can have 300 billion savings if we use data analytics and predictive modeling techniques in healthcare area. So we are actually talking about huge amount of money and huge amount of resources. So how can we use big data and data analytics in healthcare area? And especially it's going to increase, we are going to have more methods and technologies in the future. Well, using this method and using predictive modeling techniques, as I said, we can make huge profits and we can make huge savings. Well, the purpose of the healthcare, it shouldn't be making profits, technically, but it is somehow it's corporate world and we are making profits out of everything. So again, when we were talking about Mark with George Hickman, he said they are trying to find the most risky patients who are most likely not show up in the practitioner's office. So they said they are predicting death and they are trying to line up 2 to 3 patients instead of the current risky patients. So this is one way to use predictive analytics. And if you heard about CDC's data sets, they are tracking Twitter and Facebook posts. And believe it or not, they give more predictions and better predictions than current data set, because using text mining techniques or text mining methods, CDC, NIH, or other programs, other organizations can track the diseases, for example, flu trends, 2 weeks or 3 weeks before they have their actual data. So with current technologies or current models and with future, we are expecting to have huge new areas that can grow in healthcare. So the reason I'm in that healthcare area is, first of all, if you look at the current research in healthcare area, and we'll look at it as an academician, it has increased 4-fold, around 5-fold for the last 10 years. And as an academician, we and researchers, we would like to collaborate with other partners, with people in the industry. So having collaborations with industry, especially healthcare, I would say it is easy. The reason is there is huge demand in healthcare area. If you look at the job postings in Glassdoor.com, where everybody is probably looking for jobs, you can see that there is huge demand in healthcare area, in big hospitals or in big places that provide healthcare services. So as an academician, as a researcher, it is very easy and it's very tempting for the other part to collaborate with those partners, with these hospitals or with those places, and it is easy to just provide insights into their problems. So again, finally, to sum up, I would say there is huge potential in healthcare area, and again, with the variable technologies that tracks the instant human health data, it will be, I will say, it's going to increase in the future a lot more than today, I would say.
Good, thank you. You know, I want to note that the presentation this morning is being live streamed on Facebook. I don't think you have to worry. I don't think your privacy is jeopardized by being in the audience today. But I think if you watched the news the last couple of days, even this morning, one of the top stories on national news is relative to this. Pat, maybe if you could try to address really the whole issue as it relates to sort of data mining through social media.
So, great question, and unbelievably timely for this session with the news that's going on. So, I've used an analogy of two trains for a while now. We have two trains, and we just started talking about this one huge train. We need more information flying down the tracks. And this week we got the other train that everyone now sees, the other train of, they have what? They have what on me? So part of it is confidentiality, security, PHI, all this is a second train that, by the way, is not going to stop and it's only going to continue. So part of the thing that intrigues, this is not the technical part, but this is the yin and the yang of what we're talking about. And I think at one level I'm fascinated by it, terrified by it personally, in what I do for a living. So we are putting data together at MVP, beginning to use some social media data. And we have had some preliminary conversations of, is this okay? And so I don't have an answer to that. I don't think we don't have an answer to that, which I think is something we need to think about. So certainly the legal side, the sharing of PHI data is clear. That I think we have no problem with, although we do struggle in that with some of our partners. For example, our ability to share some data with downstream providers is limited by federal law, by state law. So for example, substance abuse data, there needs to be an affirmative consent every time my substance abuse data goes from one place to another compared to other data. So way beyond what HIPAA says, way beyond any New York state law. So I think that today's, in this week's news should help us to begin to think about, we've gone pretty far with this, what we call social media data and use of data, and I don't think we should stop. I'm not saying the train stops, but we need to think a little bit smarter collectively. This isn't just me, this is all of us, about what it means, and are we okay? And if we're not okay with sharing our data, we have to have mechanisms to have that data redacted. Currently today, let me use the IT side of my brain. It's easier to be all in or all out, let's be honest. The code is a lot easier. But if we have 100 people in the room and 79 are in, I got to figure out who the 79 are, I got to figure out who the 21 are. Every single time I do something. So there's a practical part that has been pushed by IT, which is probably IT, the world we're in, of social media, that is, in my opinion, is not going to continue. I think it's got to change. That you'll be able to opt out of Facebook data sharing. Because I think, I'm going a little wild here. Some of these connections are unbelievable. So my son's a fisherman, I'm not. And he didn't even know there was such a thing as Field and Stream Magazine, and he gets something in his email about Field and Stream Magazine. So on one hand, that is like, how cool is that? And he's really looking at it, he goes, maybe I should get this. But how did they get it?
Right.
I'll make it up. Cabela sold his list to make it up. Field and Stream bought it. So that makes sense. And another time, I get it about my diabetes. I don't have diabetes. So some of this, we're still not good at these linkings either. That's the other thing. So we all get emails about, something. You're like, how did I get that? Like, makes no sense. Another one like, that unbelievably makes sense. So that science is getting better, but just underneath it all, remember, we're pulling data from all different sources to link Pat Roohan to all different data stores that are available. Does everybody know that? I think this week will open up many more eyes than even a week ago.
Thank you, Pat. Thank you. And like I said, I think a lot of us will hopefully learn more in the next weeks and look how do we adjust settings and do all those things. Meghan, can you talk maybe about sort of jobs that now exist and demand for jobs as it relates to data analytics within the healthcare industry and what you're seeing through your organization?
Sure. So in the world of data analytics and healthcare, there's an increasing demand, not only because of the increasing information. So there's more information, so we need people to make sense of that information. But there's also that security that Pat was talking about, protecting that PHI and protecting that information. So there's jobs as analysts, developers, and IT professionals. So back in the day when medical information was collected on a piece of paper, it was locked in a stored room, a secured facility, and it was kind of safe there. If someone broke in and stole something, it wasn't going to be distributed worldwide within seconds. Now we're in a time where, if there's a breach at a hospital or any type of company that houses data in healthcare, that data can be distributed across the world within seconds. And, there could be a huge breach of patient health information, and that's a huge problem. So not only do we need people to understand that data, we need people to protect that data. So IT professionals, cybersecurity professionals, people who understand networks and can protect us from those people who are out there phishing. I'm sure you've probably gotten phishing emails before, and your company has, put in a place to say, these are the things to look out for in phishing emails. I'm sure you heard a lot about ransomware, WannaCry, months ago. So those things out there, we really need people to protect that information and protect our networks that are housing the data. And just to talk a little bit more about analysts, there's not just data analyst positions out there. There's policy analysts. So understanding how a policy implication has impacted a market, not just from the data side, but how that policy is actually impacted something is also, increasing as well. Developers, so business intelligence developers, so people who are building platforms to house this data so we can quickly access the data and pull information from it. And just at HANYS alone, when I started at HANYS 2 years ago, maybe there was 5 or 6 kind of analysts on the for-profit side of my company, and within the past 2 years, we've hired 4 more people. Just in those past 2 years as just analysts. That's not even taking into account increased IT professionals that we've had in the building as well as policy analysts that we have at the company. And I think it's really important to understand data overall. We recently, at my company, hired an intern position, created an intern position with UAlbany to get a student in, grad student, to give them hands-on data experience. And a lot of the resumes that we got, the people didn't have any, data analytics experience. So when I was in the interview, I was like, why are you interested in this position? What interests you? And they were like, well, I really have seen out there all of these job postings post-graduation. They require some type of knowledge of data. They require some type of skill to leverage data. So I'm looking for that hands-on experience. So I really think the field itself is increasing in data analytics, not even just for if you want to be a data analyst, kind of every position in healthcare requires knowledge of data. If you're doing a presentation or you're looking at a spreadsheet, you need that knowledge to understand what am I looking at? How should I be interpreting this? How is this data collected, and how am I going to even use this to influence others, to show others what I'm seeing, to get them on the same page as me? So there's really an increasing demand, and as I said before, when I started as my master's program 2 years ago, the College of St. Rose didn't have this program in business analytics, and when I even looked for other higher education programs, there was nothing out there. And I have my background in epidemiology, which is awesome, but I have some skills from my master's program that helped me on the job, but I would say 80% of the skills that I have today as a data analyst was self-taught and taught to me by other coworkers that I worked with through my mentoring experience as an intern, and then just kind of saying, I have this problem here, I don't know how to fix it with the data, figuring it out myself using Google. Google's great for that. But yeah, it's definitely increasing, and I definitely encourage anyone who's out there, student-wise, it's definitely an increasing field, and to go out there and go for it. You're helping, people in healthcare on a larger scale.
Great. Here we are with, basketball in full gear, and if I ever heard a layup, that was what you just had to our college professor here. So to members of the business community that are here, St. Rose graduates of this program, if you could sort of simply put, what skill sets are they going to bring to our marketplace?
Well, before talking about it, I would like to just elaborate on Meghan's ideas, Meghan's talk. So the first thing, it's data analytics, it's not a luxury right now. It is a need, first of all. We talked about the variety of data, we talked about the volume of data, so it's not a luxury, it is a need at this point. And the other thing is, since it's a need, most of the companies realize that they need business analytics. They don't want to make decisions based on their intuitions. Right now, they are making their decisions based on facts, based on data. So if we look at the trends, the job postings on many different sites, we can see that, I will again talk with numbers, we can see that there are around 220,000 job postings only for business analytics on Glassdoor, in Glassdoor. So what are we expecting? Based on United States Department of Labor, we are expecting 350,000 job postings by 2020 only for business analytics. And in total, we are expecting 2.7 million job postings related to data and data analytics. So it's a huge demand. So what are we doing for that? What are companies, universities are actually doing for it? The first and most important thing is, again, we need to look at the data. Last year, we had around 150 programs around the US, and this year it is around 300. Last year, if you look at the data again, there are around 120,000 job postings for business analytics. Today, we have around 230,000 job postings. So it is an increasing demand. In this area, in New York area, we had only 12 business analytics programs last year. I just checked it last night. We have 32 business analytics programs only in New York State. So the demand is increasing, and universities are trying to fulfill that demand for somehow. These programs are mostly online. Some of them are on-campus, face-to-face programs. In College of St. Rose, we are having a face-to-face program, and I can say it's a newborn baby program. It is a newbie. It's been here only for the last 1 year, and we are going to hopefully have our first graduates by the end of this summer session. As College of St. Rose, we are constantly checking the needs of the industry. The first time I came here, we had some courses, and we came together with our business faculty, our dean, and my chair, and we said, okay, let's look at the needs in the industry. What do they need? Do we need to make changes in our curriculum? And based on the needs of the curriculum, we made our changes. So what is our benchmark? Our benchmark is the job postings on many different sites, specifically Glassdoor. Because Glassdoor is a representation of the US demand in this case. And we added 2 new courses. We replaced 2 courses, and instead of those courses, existing courses, we put 2 new courses. What are we trying to achieve? I will talk with technical terms, because this is necessary to understand the concept in this panel. So if you look at the needs in the industry, we will see that most of the companies need people who have experience in SQL or Python or related software. In our program, what we are doing here is we are offering 7 required courses plus 3 courses in either marketing or management track. And within these required courses, we are teaching statistics, predictive modeling, machine learning with our operational research, big data, database theory and design, and also business analytics capstone courses. These courses help students to develop their knowledge and intuition on R, SQL, Python, also Ample, which is an optimization software, and they get huge knowledge on Excel. So we provide students with different backgrounds, and we try to make them ready for the market at this point. And we are not only, again, coming up with these ideas. We don't just say, let's come up with a course and put it in our program. Again, we are constantly checking the needs of the industry, and we are trying to collaborate with the industry professionals. Again, earlier we had a conversation with Mr. George Hickman, and we are planning to collaborate with Albany Medical Center, and we'll hopefully get data from Albany Medical Center to make intuitions and help the practitioners in that medical center. So as a college, once our students graduate from this college, we expect our students to have at least intermediate level knowledge in coding, and also intermediate level knowledge in different areas that we provide here. I'm not saying advanced, because I would like to make very good suggestions about it. It is basically, if you teach 100, students will remember 60% of it. Hopefully. So it is. So that's what we expect from our students, and we do everything to prepare our students for the industry.
Terrific. Well, I think that when you talk about all those job openings, and my guess is there's some in this room that have those openings right now. So you heard that this summer they'll be having graduates, so you know a new source for your skilled workforce. There's a lot more questions I could ask, but before I ask any of my questions, I want to open up to the floor. Are there any questions that any of you have, either generally or you want to direct to any of our panelists? Don't be bashful. Yes. Anyone have one? All right, well, if not, I'm going to ask one, but no, do you have one, Mike?
If you don't mind,
Go ahead.
like that, because I'm very interested in the second train. You know, we tend to, and me being an academic, we tend to look at the positive side of it. And you kind of alluded to, is there a danger of just disregarding the negative side? And then, I know we all have to do, would you like to see like government regulation? I mean, how would you approach the problem of data security?
Thank you for the softball.
Yeah. Easy question.
So to be honest with you, I don't know the answer. I'm in it, and I'm usually a guy that can come up with an answer, because this is unbelievably complicated. And I think what the practical side of me says, to really do this, we're going to add a huge layer on top of everything we do. And the answer to that could be, and that's okay, because we believe this. The privacy, the fact I don't want to share my son's fishing information, and you know, some people don't want to share that, and that's what this country is about, right? So the other thing that's taken for granted, for many people, they believe all this is already being shared in health information. So when we have more people. When I was at the State Department of Health working on the shiny and electronic medical record, there were more individuals upset that it wasn't being shared. Not that it was being shared, but we have laws, rules, regs, both federal and state, to slow it down. So I don't have an answer for that. I appreciate the easy question, but no, I think this week it could be a watershed moment of, we really may need to, I hate the word slow down, because I don't slow down, but to rethink of how we're doing this, because I think there's a lot of ramifications here. And obviously there's some, so this is not all for the good, as we're seeing. So, thank you.
I would almost think this is a case where, while a lot of us probably don't think that more regulations is the answer, I do think this is a case where a lot of us, there's a certain level of privacy that we expect, and if the market won't bring it on its own. But we'll go right here and then back here. Yes, sir.
Okay, just a moment.
Yes.
I need to give you the microphone so our live streamers can hear you.
Yes, I just have a question for Megan. Could you speak about the title of analyst and how either specific or general that is?
Yeah, so when you're thinking of an analyst, kind of what is that? I remember when I first started as a full-time position, and my title just said analyst. And I was like, well, what does that mean? Like, what are my job responsibilities? What am I going to be doing on a daily basis? And I've just found that analyst can mean many different things, especially in the world of healthcare and what I do on a daily basis. I work with numbers a lot, so transforming numbers into plain thoughts, plain English, and then giving that off to people. So to me, analyst means actually analyzing information, pulling what you need out of it. Also, as an analyst in healthcare, it's protecting the lives of the individuals, the data you're working with. Also, on a daily basis, I work with clients, so I do training with them. I kind of make their lives easier. So I take complex information, that's stored somewhere far away from here, and I kind of transform it into small ideas that I can actually use in their presentations, use in decision making. Then they can pass that off in their work to others in the work that they're doing at their facility. So the word analyst is kind of a very broad term, and when you're working in the healthcare industry in healthcare data analytics, that term will change a lot depending on where you're working and with what data set. We have analysts at HANYS. They all kind of have the same iterations of title, but they do completely different things. They work with different data sets on different topics with different types of clients. So it really depends on where you're working. And once you're actually in the field with either an internship or a full-time position, you'll kind of start to specialize, just like, for physicians, they specialize in whether it's pediatrics, oncology. Once you're actually an analyst and you get that experience, you'll start to specialize depending on what types of data sets you're working with and what types of coding experience you have. So as was mentioned, SQL, Python, R, SAS, there's so many things out there that you can use to manage this data, and it really just depends on your preference. We have some people at our company who are geniuses, some people who are great at SAS, some people who only want to use SQL. So once you actually get into that industry, you'll start to specialize. And the term analyst is very broad, and it really just depends on what you're doing and in what context.
Great, thank you. Yes.
I think this is on, yes. So what does the data show in terms of outcomes for patients and quality of care? Like if reimbursement models are changing so that outcomes matter more than services provided, is all of this data that's being shared, what's it doing for the people? Not just costs to the hospitals, because obviously that's very important as well, and that's the driver here, right? But what about quality of outcomes?
And maybe, Pat, do you want to weave into that as well?
So a lot of the work that not just MVP, but others in the state being pushed pretty hard by the Medicaid program, there's value-based payment, value-based care model. So the idea is that the decisions are made for healthcare not based on volume, they're based on value, and that's a little bit of rhetoric, right? But a lot of these arrangements, they have to pass some metrics of quality to actually share savings. So say we have an arrangement with a group and that we're going to share savings if we save money, but you only share savings if there's money to be saved, and you only share savings if quality gets by we call it a gate. They have to have some level of quality that is improved. So quality is actually built into a lot of these VBC arrangements that MVP is putting together with our partners. It's still pretty early on this, although it's been out for a little bit, but it's still, we're still, MVP is pretty early, the state is pretty early. There are some successes out there on this. But it's not a magic bullet, though, and there are some programs that it has cost more money. We think passing on risk, giving providers, control. Sometimes they don't want control, and sometimes they're not good at control. And sometimes control of cost, by the way, is really, really hard to do wherever you are, plan, provider, ACO, hospital. So some of these I still consider a lot of this experiments, although we're going full-fledged as a state, because we really don't know if it'll really work all the way where, we can really truly, and I'll say truly, bend the cost curve and improve quality.
Okay. So. If you can pass the microphone to the gentleman right behind you.
My name's Kevin Connolly. I'm the executive director of Hope House. We're one of the agencies that partnered with another agency, and we're the lead on receiving a BHCC grant from New York State, the Behavioral Healthcare Collaborative. And our task is to enter into contracts for value-based payment. And a huge portion of this is data analytics. So I'm getting a real crash course in this really quickly. And here's what we're finding. We've brought on 50 downstream providers to be part of our collaborative. We have a very large Medicaid population that we're working with. But what we're realizing is a lot of these providers certainly can't provide data analytics. And some of them don't even have appropriate IT systems in place. So that's a real consideration when you start talking about some of these things. Under the value-based payment, what are some of the things that the nonprofits can really have an impact on? I think we could really probably make some real inroads with smoking cessation. I think we can make some real inroads with making sure that patients go to see their doctor when they're supposed to. I think we can make real inroads making sure that prescriptions are filled within a 24-hour period of time. But this whole thing is really fragile, and we have to be able to provide an infrastructure for providers to be able to do this. Or I think we're going to fall short. Any thoughts on where some of the resources are going to be able to come from to help some of these providers? Us, us included, we're not a monster size nonprofit.
Whatever you want to take the swing at it, go
I
ahead.
could take the first swing at it.
Mine wasn't a softball.
No.
So at HANYS, we have various divisions, and one of our divisions is data gen. They have experts in value-based payment, both the oncology care model, CJR model, bundled payment care initiatives, the new one that just came out. And they work with providers across the country for these 4 initiatives to help them understand their data. We have platforms, infrastructure, both platforms that are outward-facing for the client, and then we have the IT structure to actually support and house that data. So those are some of the services that are out there. We have them available at HANYS under our data gen division. And we have experts that have been working with payment reform, bundled payments for over 20 years. So you'll have both of that at your exposure as well.
So I'll just add a little bit to that. I think at one level, this isn't fair, is I think what you're saying. I think the world is moving toward we need more information, and now we're passing it on to providers. So providers, healthcare providers in New York that can do this, certainly hospitals as a provider group can do this with some help, obviously. But most providers, especially not-for-profits like where you are, do not have the expertise because you never needed the expertise. And then all of a sudden, zoom ahead, you got to be like analytically sound and figure out if we're doing the right thing. I think some of that's completely unfair. I get it. I think the way to do that is probably partnership with some people that can do it. DISRIP was meant to do that. I don't think we've seen some successes there, but some real struggles there in terms of DISRIP is in between providers and plans in the state. Again, the second train is there. What do they have access to? What do they legally have access to? And the ability to really have data to say, are we really improving as a provider group, or not even two not-for-profit community-based providers like yourself? Even a large physician organization does not have a Meghan to do this or a Pat to do this. They don't. They didn't. Now they're starting to, but even that, it may not be enough. So I think we got a long way to go there.
Great. With that,
I have
go ahead.
one
Sure.
more sentence. So
Yes.
we will have students to do that for you. So we will have students graduating this summer. You can have as many of them as you can.
Terrific. And a perfect way to start my wrap up. I want to thank the college for putting together this forum today. I think that those of us who live and work in the Capital Region know, I think one of the distinct elements of the College of St. Rose is really their connection to the community. And I think that we see it here today. So I think one of those pieces is exactly what was just highlighted, the connection of our area businesses and the students that are here at St. Rose. And so I hope that some of those connections happen today. Those of you who are businesses who might not have any formal relationships with St. Rose, I would encourage you to pursue those because I know, I can speak from firsthand experience, that they'll be beneficial. I'd ask you to join with me in thanking our panelists this morning. And I think Mike has some wrap-up comments.
I'd like to reinforce what Mark said. Thanks everyone for coming. You mentioned libraries, encyclopedias, and microfiche. Actually, I'm a little older. I remember chisels and stone tablets. So data collection, data recording has come a long way. And the train is not slowing down. It's speeding up. I think we have a lot of issues. There's certainly a positive side, but there are also some dangers in here. And we as a society are going to have to figure out how to deal with that. So thank the panelists. Thank Mark. And we have a little, whoa. I said it was under the podium, but I didn't know what I was looking for. You have a little.
Oh, great. Thank you very much.
Thank you.
Well, thank you.
Sure
Thank you
thing.
very much.
I know we do have a hard stop. I think some of the students may have classes. I think some of you probably have day jobs you need to get to. So again, I appreciate everyone for coming, and we hope to see you again.
Great meeting you.
Thank you so much. Thank you so much.